I have a friend that walks with me, and we walk at a park nearby called Wooten Park. Decided to go a little bit further on this day, and I tripped over some railroad tracks. Bang! My cheek and this full side of my face hit the pavement. My friend wanted to take me to the hospital, but I said, no, I want to go to Dr. Jackson right away because I could feel this tooth was quivering.
I looked at Miss Ada in her mouth and I realized very, immediately that, oh my goodness, there's no tooth there. Let's check out the area. Doesn't look like anything's broken. Okay, take an x-ray. Yeah, that tooth, you had about 1 millimeter sticking above the gum line, so obviously that can't be fixed. So I thought, we gotta help Miss Ada. She's a nice lady, we gotta take good care of her.
They took me right away, and they asked, how long ago did this happen? And I said, 15 minutes ago.
If it were my tooth, I'd want to take that tooth out, put an implant in, et cetera, and eventually have a fixed tooth on there that you can floss like a regular tooth in the end. That's what I would want in my mouth, so that's what I recommended for you. And that's what we did.
I was comforted the whole time. They even made me laugh, which I'm a happy person, so I laugh a lot, but I just felt so good about it. There was no pain involved. I just was grateful that within 1 week that I could get a temporary. So I have a temporary now, and it matches the rest of my teeth. Yeah, this whole process, the doctor makes me smile even more. I look good.